Today is Monday, August 12th, 2024, and this is the De Pere City Board of Health meeting. We'll start out with a call to order. If we call the meeting to order, roll call, please. Be Pamela. Anybody know where Pamela's at?
I don't.
No word? Okay. Pamela Gatz, Alderperson. Alderperson Devin Prock.
Here.
Terry Gulas.
Here.
Dr. Michael McHenry.
Here.
Dennis Highbury is here. Also with us is Crystal Wohler, Health Officer. You're supposed to say here.
Here.
And Kelly Burke.
Here.
And we also have our student intern with us, Austin. Austin, I didn't catch your last name.
Curbs.
Curbs? Okay.
K-E-R-B-S.
Okay, well, welcome as well then. Thank you very much for coming and being with us. And you started how long ago?
Is that
In
July?
No,
You're
May.
in
May? Okay.
I know this summer.
End of May.
End of May. There we go.
Okay. I don't see anybody in the public, from the public to comment on any matters on the agenda, so we will not do anything like that, although I do want to recognize actually Crystal and Sarah and Danielle for being here. There comes Paula right now. For being here on National Night Out, which is August 6th, last week Tuesday.
Yeah.
And they came around in their camper.
Yeah, they did.
How else can you spot it's a camper in
It's true.
it is camper and showed a bunch of people around the city, I guess what it looked like, but we had our block party as well going on that night, and it was nice to talk to them. I know that Pamela was also out, and Pamela, if you want to say you were here as well.
I saw
you're-
you, but I
yes.
didn't see anybody else.
So
But we did
making
have
the
some
rounds
good
as well.
ice cream, so thank you for that. Dinner.
So we've done the roll call then, and we've done public comments. So let us look at the approval of the May 13th, 2024 meeting minutes. Has everybody had a chance to read those, take a look at them? Any changes, any thing that we want to change?
No problems.
No problems? Do
Make
I
a motion
hear
to
a
approve.
motion to approve?
Yeah, I'll move to approve.
Do I hear a second?
Second.
Any discussion? No discussion? All in favor, say aye.
Aye.
Aye. All opposed? Motion passes. Okay. As I was talking to Crystal, this is a 149-page agenda we've got today. So it's a
Yeah.
lot of stuff, but it's a lot of contracts, I think, if anything, over
Yeah.
here. So that looks like it's, and I didn't read all the contracts, by the way, either.
Okay.
I said as much as I wanted to, but it was worth it.
I thought if anybody would read them, it would be you.
You tried to read it, Terry or Pamela?
Oh, yeah.
I read them all.
You read them all. Okay. Discussion of the draft 2025 Health Department budget.
Yes.
And Crystal, I'll let you start things out. We actually have two budgets here. One is one that the city wants to have, and the other one is for the health department. Am I correct on that?
That's correct. There's
Okay.
one,
That has everything.
yeah, the revenue budget, we don't have our own health department revenue budget. It is mixed with the city's revenue budget. And so we have line items within the revenue budget that the health department owns, I guess you would say. So that's first in the agenda. And really, I kept the revenue projections the same, except for the public health revenue. I could not figure out what the previous health department director, there was a lot of revenue that came in, and I do believe maybe some grant revenue or something else was put in that account. I can't quite pinpoint it, but for our health department public health revenue going forward, it should be about status quo, about 400. You'll see that in the 2023 adopted budget, it was about $315. So basically the public health revenue is like selling radon test kits and any private pay flu shots that we give. Mostly we give no cost free flu vaccine. So any of that revenue is very, very low. We did have a contract with St. Norbert College to do T-spot testing. And so we would pull in revenue from that, but in that same vein, we would have to pay out an invoice to, the laboratory. So that contract has also discontinued just because St. Norbert College is now partnering with Prevea Health to provide their direct healthcare services. And so I just project going back to the 2023 adopted budget for revenue at about $400. So that's the biggest change. You'll see that negative 71.43% difference. But really, our weights and measures revenue, it's coming in about where we projected. Our DAT cap restaurant licenses actually came in at about $10,000 more than projection, and I know you all passed, that fee increase the last budget session, and so that's accounting for more revenue coming in, which is good because the expenses for that program have gone up. So that was a good, a good change that Debbie had brought forward to you all. So that you'll see as an increase in revenue. So I kept that going forward. But really, everything else is status quo. We are getting a little bit of a bump with our health matching grant. That's our consolidated contracts with Wisconsin DHS. What you're going to see is that COVID-19 grant, that's taking a big dip, because at the end of this year, a lot of those COVID grants are over. Now, there is one grant, and that's an infrastructure grant that is carrying forward that I wanted to really put in a separate line that's just put under state miscellaneous grants, just because I wanted to track it outside of COVID. So, so you'll see that change in there. That's about $35,000 a year for 3 years. So you'll see that again and again going forward until that third year is up. So those are the highlights for the revenue. Any questions?
I must say, I'm glad that the COVID money is now gone, because that means that COVID's been reduced a lot as well in terms of your time and effort and
Well-
its effect on the public, so.
And that, I was going to ask about that. Is it coming back a little bit? Are the numbers a little bit higher again from what I'm hearing?
Yeah, we've seen some increased numbers in the wastewater for sure. I think until COVID reaches that seasonality that influenza is at, we're going to see these increases in the summer months. So they say it's going to take a few years for it to, what would you say, mirror the seasonality of influenza. But yeah, we're seeing an increase in the wastewater in cases coming through. And just remember, the public health departments only follow up on hospitalized COVID-19 cases, so those are the ones that that public health follows up on.
Are they a little more mild though than they were initially?
Yeah, we're not seeing a big insurgence of hospitalizations, but we are hearing just, because we do have such a small community, we are hearing of cases, and then the wastewater reflects that as well. But yeah, I don't think that, we're back to, 2021 or anything like that. I just think it's that season, the seasonality that hasn't mellowed quite yet.
And then the adopted budget, what was the seasonal labor? It looks like it was down.
Oh, in the expense,
9.77
in the
in the
expense,
general fund.
yeah, in the expenses, right?
Mm-hmm.
Yeah. So our, so let's go to the expenses. If everyone's good with the revenue, are you okay if we jump to expenses?
Yes.
Okay, so the expenses, good question. The LTE staff that were previously employed had been discontinued. So that's where you see that drastic decrease. So the only seasonal staff we have is our seasonal intern. And then we also contract
You get
with
paid?
one of the community center staff to assist with bingo size.
Oh.
So that really is all we have for seasonal staff. So that's why you see such a big
Okay.
drop.
What I thought.
Yep. Good question. And then what goes with that, right, is the health, the dental, because we did have some LTE staff that had some benefits, but then also because I didn't choose the health insurance, we'll see the dip there. So, so that's that 14.92% decrease in the workers' comp, dental, health. But other than that, some of the biggest changes I wanted to talk to you all about in the expense budget was really when I started and I talked to Kelly, we really wanted to align weights and measures and the agent program expenses to the program in the city's budget. So we've added a new line item for specifically agent program and specifically weights and measures so that we can track expenses better to align with the program revenue. So you'll see that $3,000 for weights and measures was never budgeted before. And that agent program, again, $3,300 was never budgeted before, but I really wanted to create a line item. And again, it is offset by program revenue, but this will help track direct non-personnel expenses better. So I think it's really going to serve us well. We did see a little bump up with immunization outreach grant. And then again, that public health infrastructure grant, it mirrors the revenue. So we get the revenue in, but we also have to match the expenditures for that public health infrastructure grant at $35,267. And the only other one is that COVID immunization expense. Again, that's the only COVID carryover money that we are allowed to bring forward to this new budget year, and we have to spend it by June of 2025. So that has to be spent by June. So it's not even going to take us throughout the whole fiscal year. But
Crystal, can you address with me the agent program? This is also a new line item as
Yep.
well.
Yep.
About what that is and what.
Yep. It's just to align those program costs and pull them out of the general public health type line items for better tracking. So that's the purpose, is to create its own line item in the expense budget so we can better track by, they call them account numbers or codes, so that when Trista has an expense for the agent program, we can put it right in that expense budget and not have to do like 3 different spreadsheets to track it because it's tucked in all the other stuff. So I think it's really going to help accounting and Kelly in that way as we look at how much the program is costing outside of the personnel expenses.
Well, what would be an example of an agent program?
Expense. Yeah, so like something small would be like pool sample supplies.
Okay.
So to do the pool inspections. Also, another expense, if Trista, if she needs a new thermometer or if she needs new gloves, or think about weights and measures, like if the scales, if she needs to go and get the scales calibrated down at the Wisconsin State Lab of Hygiene, that would be an expense that would go under weights and measures.
Okay.
Conference.
But like for that I can understand. It was just the agent programs. I wasn't sure what.
Yep.
that was. So.
Yeah, so pool samples. I'm trying to think of other expenses that usually go under
If she has to drive anywhere, like her mileage previously would have been in the mileage account, but if she has to use her personal vehicle for something, now we can put the mileage right in
that's
this
good.
expense.
Okay.
So little things that were in other accounts before, like office supplies or mileage account or conference account.
Okay.
Now we just don't put them in those accounts and we put it in the new agent
Okay.
expense account. So we know exactly what we're spending on that program.
Okay.
Yeah, because before Kelly had like
It was
different
kind of spread
spreadsheets.
out everywhere.
And she was trying to look back at all the expenses throughout the year and trying to pull out those expenses.
And
'cause-
like the mailings, to mail out the renewal notices and stuff, that would have been in our postage account.
Okay.
Whereas now we can just put it all right in this account. So
Nice.
it's easy to track what we're spending on that program so that when we bring in the revenue, because we're supposed to break even.
Okay.
Yeah.
So it's just a lot easier to
Okay.
look at it.
Christine, I have to be refreshed on this. Do we pay the state any money for being an agent?
Yes.
We do pay them a
Yes.
certain percentage or
Yep.
a
Yep. And we don't
so much
pay
per
it.
place.
It's interesting you bring that up. We don't pay that out of the expense. We offset our revenue. So it's almost like a negative revenue. So they take it out of the revenue account. And it's a percentage that we have to pay back to the
Okay.
state.
I was thinking that was part of it, but it's been too
Yeah.
long since I've been out of the business, so I
Yeah.
don't remember.
They usually bill us in what, October?
I have to do that. That has to be submitted by September 9th.
Oh, September 9th. So
Okay.
So we have
September.
to pay it by September 9th. So probably in the next week, I'll be putting those numbers together.
So although we're an agent of the state, we do have to pay the state.
Doesn't seem fair.
Or the technical assistance they provide us
That's
and
correct.
to keep their program going.
The software.
Solvent as well, then,
Yeah.
we got software and so on, okay.
Any questions about the expenses? And again, this has to go, Larry, I haven't sat down with Larry yet. I did sit down with Pam just because I'm new again at this budget process. And so I did sit down with Pam, but I haven't reviewed this with Larry yet. So that comes next. And then, of course, this goes to finance and through the city's budget process. So Pam and Devin will get to see and hear this a couple more times. But I wanted to just show it all to you so you had an opportunity.
I like the idea that you broke things out even further to make it easier for you to determine where those costs are coming from or what the costs are instead of having to dig deeper in other accounts, so. Now, this is discussion item. Any other items we want to discuss as it relates to the health department budget? We don't need a motion on this because it is just discussion only. Okay. Hearing none, let's go on to discussion of the Board of Health budget.
Right, and I kept that pretty status quo. With that, I did, as a result, of your important measures, performance measure, I did include that you approved the policies and procedures as of May of 2024. And then also the One Health policy you brought to City Council for consideration, I cited as the FDA information sharing agreement that you approved already this year. So although it's an agreement, it truly is a policy change within the department. And so I think that counts as your performance measurement data. So appreciate that. And then just a reminder that you all do have $100 to spend on any professional development webinars. We really don't have any meeting fees anymore for WALDEB because they don't cater
They don't
lunch.
care lunches anymore. I
It's
saw
bring
that.
your own lunch.
Oh, yeah.
So,
I noticed that.
yeah, right. So if there's any public health type webinar or any fee for professional development in that regard, just remember you have that money set aside.
It's nice that WALDEB is doing those webinars monthly, it looks like.
Thanks for participating.
Yeah,
Yeah, that was good.
yeah, it was interesting.
Good.
Well, I'm sad they aren't doing lunches anymore, that's what I can say.
That's the only reason you went.
So that was a nice, well, it's still a bag lunch that people socialize with and stuff like that, but
Yeah.
it's something else to bring along with you, I guess, isn't it? Any other discussion regarding the draft Board of Health budget? Hearing none, we'll go on to number 7, which is consideration and possible action on Wisconsin DHS Contract 62109-2 in the amount of $9,239.
Right. So this contract was already approved, but they did give an additional $300. So anytime the contract changes, they revise the contract and they need to bring it back to you all for review and approval. And then if approved, I get to bring it to City Council for final approval. So this is for an additional $300 to that same contract.
Okay, and that's the reason why it's additional $300 then. Okay.
Yep.
Well, you can buy lunch for us if you
Yeah.
want, I guess, can't you? Okay. Any discussion? I have a motion to accept the consideration of the DHS contract number 62109-2.
So move.
So moved. I hear a second.
I'll second.
Any discussion? All in favor, say aye.
Aye.
Aye. Opposed? Hearing none, motion passes. Okay. Okay, another consideration and possible action on the Valley Cabinet quote and agreement.
Yeah, so embedded in the packet, this is a quote from Valley Cabinet. We did follow the city's purchasing policy for 3 quotes. This is the only person that returned a number to us. And so this actually, we are using our public health ARPA money that needs to be spent by the end of December. This is not the city's ARPA money, but public health ARPA to get new immunization room cabinets. It's laminate right now, and there are some peeling pieces. And then new countertops. Again, right now they're laminate. And I mean, they've been there, I don't even know how many years, but we're looking to use our public health ARPA money, which has been approved by Wisconsin DHS and our spend down plan for public health ARPA. So we also just need to follow and want to follow the city's purchasing policy too. So we're bringing it forward to you all for review and consideration. And then again, if approved, there's an agreement that goes along with that for Valley Cabinet, and then we would bring it forward to City Council.
I do have a question.
Yes.
The Corian top,
Yes.
what's the reason for that one other than other tops? I guess it's because
Yeah.
it stays warm or something, or is it, I know granite's probably stays cold if you immunize
Yeah.
people, but
Yeah, the Corian, it's a solid surface, so it is, it lasts longer, especially with as much as we wipe it down with the healthcare, like bleach solution.
Sure.
And so it's just more durable.
Durable.
But it's definitely not granite,
No.
but it's a solid surface so that you don't have that peeling laminate.
All right.
okay.
So I think that'll
That will
outlive-
last. Yes.
it will outlive my time.
This
and
building, I think.
everyone's
yes.
time.
Okay. Any other discussion about this item? Valley Cabinets number 8. If not, do I hear a motion to approve
I'll make a motion to approve.
cabinets and so on and
I'll
take
second.
in top? I'll second. Any discussion?
No.
All in favor, say aye.
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 Opposed? Motion passes. Okay. We had a lot of considerations in here. I must say that. Consideration and possible action on affiliation agreement between MCW and the Pere Health Department.
All right, so this is another student opportunity. We have an MPH student, Master of Public Health student from MCW Milwaukee, who is wanting to do their project and their rotation with the Pere Health Department. And so we are looking for an affiliation agreement between the 2 agencies.
Excellent. You know what the project is yet?
The proposed project, and she hasn't finished the write-up yet. She's working with her professor. But it is a health and all policies ordinance. So there's a little teaser, health and all policies ordinance. So we're looking to bring that forward for consideration. Again, need to review it with city administration and city council and you all first. But that is what she's going to be working on with Sarah
What
and
is that
myself.
again?
Health and all policies.
Health?
And
In
can you
all
explain that a little
policies.
bit?
Yeah, sure. So City of Appleton did this probably about 5 years ago. And so the ordinance really is just putting an emphasis and a priority on looking through a health equity lens and making sure that even with comprehensive plans, let's say unrelated to public health, let's say it's the parks comprehensive plan, that they're looking at, what things could be improved for health, right? And, making sure that, this is just one example, making sure that there's ADA compliant, park equipment or something. So it's not just policies that the health department brings forward, but it's health and all policies for the city. Unrelated to the health department. And so that's really what health and all policies is about. And so we could make it look however we want to have it look. But she's doing a literature review right now. And then also, again, looking at City of Appleton and other communities that have implemented it to write up her proposal. So lots of meetings will be forthcoming and lots of discussion with you all. And she knows too that, it's up to everyone's, it has to go forward as an ordinance, right? So it's up to the Board of Health, it's up to the City Council, and she knows that it may not pass, but she's prepared for that. So, but she wants to put the work in,
Yeah.
and we want to work alongside her.
Nice, yeah.
So MPH, Masters of Public Health student with MCW.
And we have her for 80 hours.
That's correct.
Okay.
Yep.
How do those 80 hours get spread about?
Yeah,
over
she
the
said it's,
year?
yeah, she's thinking a semester, but it depends on her workload. But she's thinking she wants to finish it in one semester.
Oh.
So by December. So,
Okay, cool.
Are those 80 hours going to be on site here in De Pere?
yep.
They will be.
Yep.
Okay.
And we have a workstation in our conference room for an intern.
Oh, nice.
Okay, any discussion on this?
So I didn't see in here, so if she finishes her project at the end of December, would you be able to have another intern in the spring semester?
To carry it forward.
Well, either to carry it forward or to do a new project?
Yeah, I mean, that's our hope.
Yeah.
Is that would be
Yeah,
a long-standing.
that's a good question. When do
agreement.
you see them ending and starting? Are they going to be a fiscal year? Is that a?
Oh,
or a-
well, for this project itself, it will end at the calendar year. But
Okay.
could it continue on with another student doing another
Who would
project?
begin at that time? It's not like going to be like they begin in August and
Right.
each August. It
Yeah.
depends
kind of
on when the person's done.
Follows the
Right.
school semester then?
School semesters, yep.
That's
Yeah.
our favorite.
And it depends on the student interest. If there's another student that wants to be in De Pere.
Mm-hmm,
So,
cool.
Now, the Medical College of Milwaukee must have approached you with this. She did, because I mean, we have medical college over here in St. Norbert as well. They,
Isn't this person from
she
campus
act-
here?
No, not on campus here. She's the
Surprised.
MPH student. And
I'm
so that's
surprised.
Central Milwaukee. Yeah.
I'm surprised. I
Yeah,
thought
I
I
think
just
she lives-
assumed that it was part of St. Norbert's campus.
That whole
presence.
campus. Yeah, no, Central Milwaukee. But I think she lives in the area, and that's
Okay.
really why she
That's
chose.
okay.
Yeah.
That makes sense.
Yes.
I
Nice.
think it should be most interesting to have
Yeah.
that
Yeah.
kind of resource here to help what she's going to be doing, I guess. So,
Yeah.
Nice job getting that through.
so can we have a motion to accept?
I'll move to
so
accept.
moved.
I'll second.
A second. Any more discussion on this? Hearing none, all in favor, say aye.
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 Any opposed? Motion passes. Okay. Item number 10, consideration and possible action on fiscal year 2025 Wisconsin DHS TB dispensary contract.
Yes, so this is a standard contract that local health departments have in place. And really, we don't need to execute this contract on the regular. It is, the state of Wisconsin offers to cover medical expenses related to TB, active tuberculosis, as a payer of last resort. So typically, it's private health insurance, right? And then it's state health insurance, so Badger Care, Medicaid. And if that's not an option, then, this is like the third safety net option. So it's very rare that we have to execute any bit of this contract, but it's good to have in place as a safety net. So this is a standard.
We've always had that in place. I've never seen it before, so
Yeah.
Yeah. I, but
Yeah.
I guess I didn't realize it was like 40-something pages
Yes,
long.
right.
Right.
I think it took the
Kicker, I
majority
guess.
of
I
your
look at that and I
remember
say,
seeing it. I think if we knew it was there.
I mean, we know by weight how much
Yeah.
important it is. Okay. Well, good. At least we've got that thing going, I think. So let's have a motion to consider the possible action of the DHS TB dispensary contract. Can I hear a motion for that?
So moved.
So moved. A second?
Second.
How about any discussion
So
whatsoever?
I just what happens with this now? It says document in progress. So it's signed, it's completed, it just goes back on record as active.
Yep. And then it allows us to bill the state
When
for
was-
reimbursement.
When was the last instance we used it?
You know, honestly, even the last time I was here, I've never
Yeah.
used it. So I
Hasn't
can't
never
even
come up, yeah.
I can't even think about a time or even go back and see. It's just so rare.
How
But
many-
then after this, we need to bring it to city council for approval, and then we can start
Okay.
if
Okay.
it needs to be activated.
Do we have any TB in De Pere?
Not active TB.
Not
We have
active TB.
latent TB infection
Okay.
that we're providing direct observed therapy for. So sometimes people have the infection, but it's not active. So we want to keep the infection at bay and give antibiotics so that it doesn't become active when they're immunosuppressed and 80 or, fall ill with, God forbid, cancer or something like that. So we are treating, at least one person right now with latent TB infection. So that happens on the regular. Active TB, I've only worked with one in my public health career, and that wasn't the city of De Pere. So thank goodness. I know Brown
It's
County Health
okay.
Department has more,
Has
but
more. Okay, well, let's, I guess we made a motion and passed that already, did we not? Okay. Number 11 then, consideration and possible action on DSHS EpicCare Access Agreement.
all right.
This is one you have to explain.
Yes. So, historically, we as nurses, when we're doing communicable disease follow-up, need to request medical records, and it's very time-consuming, and the records take a while to pull, but then they have to be faxed, and then we enter the appropriate Wisconsin DHS information, and we can close the case then. Well, with this, health departments are now able to get restricted access to Epic just for the portions that we need to finish our job to close a case out as far as public health follow-up. And so the unfortunate part is right now we have to go to each health system's Epic and get those agreements signed instead of it being a statewide initiative, right? So right now the agreements we have in front of us are HSHS, and you'll see in the next one, Gunderson as well because of the merger with Bellin and Gunderson.
You mean amplify?
Amplify, right, right. So that is the purpose, just to get the information in a more efficient, more timely way. It allows us to have secure access to Epic just for the public health purpose of closing out those cases and getting them sent down to the state.
And that is going to these agencies and having them, because you don't want to be trained in Epic. They will provide you the information
Right.
from Epic
Yes,
to you then.
That's
Okay.
right. Yes. Yep. And so it just allows that pipeline, and it's of course HIPAA compliant, and we have secure access with the username and password. And so it's just really going to help. Again, the only thing I wish that could be different is that it could have been a systematic approach to and not having each, if you think about, there's 70 some health departments or more going to the health systems asking for
Will all the cases, say in the disease listed, all those would require you to enter into this? Is that what we're saying?
Yeah,
What I'm wondering is what ones are going to be reported in this manner?
Yeah, so the cases will still be reported in what's called the Wisconsin Electronic Disease Reporting System.
Right.
And then we would go into Epic with our secure username and passcode and request information to close out the cases.
So you didn't have to do that with every case, did you? By requesting records and wait for those to
A
come?
lot of cases, yeah. So even like the chlamydia cases,
Yeah,
which
that's what I
seem
mean, about
so
70, 80 of those you'd have to
we
do.
have a lot, right? But we need to have treatment date and treatment antibiotic type that we have to enter. So the nurses they call medical records, they get the facts, medical records of that visit date, read through and see what antibiotic was prescribed, what date it was prescribed, and if it was the right regimen. And sometimes, it's not. And then we call the doctor's office and we just, talk to them about the recommendations. So it is a process that takes time, and we're hoping that
It
this
should
will.
speed it up by a lot.
That's what we're hoping.
I was going to say that must take a long time to even get through the medical records.
And it is. It's like
And I used to work in medical records, so
yeah,
I bet it takes a while.
it takes a while. Yeah.
Well, good. Well, they have to do this for every provider, though, so will we be seeing more of these?
What about Aurora?
Yeah, we have Aurora ready.
You do have it.
There wasn't an agreement that we know of yet. So they provided us secure access. And so we'll see. Maybe it's coming down the pike and you'll see it on the November agenda.
Yeah, that's surprising. Yeah.
But we have Aurora Access. This is HSHS. We're getting Gunderson and don't know if we also have to do Bellin. Not sure.
No,
with the
probably not.
So there might be more in November, but we're hoping that this at least will take a majority.
Okay. And all the healthcare providers in this area use Epic then? Okay.
Do you know if they'll eventually be going to a statewide thing?
I hope so.
Yeah, you would think.
Yeah. They call it data modernization. I've heard the state talk about it since I've returned. I just think it's going to be a while, like months,
Well, it's
years.
nice that they're
maybe.
actually able to integrate using Epic here. They were able to, bring my records from Virginia
Yeah.
to here. So
Yeah.
it used to be state specific, and so it's gotten better.
Getting better.
Yeah.
So do we have a motion to approve for consideration the possible action with the HSHS EpicCare Access Agreement?
I'll make a motion.
Do I hear a
I
second?
don't have to say all that, though, do it?
What he said.
And do I hear a second?
Kidding.
Second.
Okay, all in favor?
Aye.
I'm sorry, I forgot discussion. Any more discussion first? All in favor? Aye, we had that. All opposed? Hearing none, motion passes. And number 12, Gunderson Epicenter Access, which is the same kind of thing. We've had discussion already. Can we, is there anything, anybody has any questions about number
I'll
12?
move to.
Move
Now,
to approve?
why is it shorter? A lot shorter.
Yeah,
I'll second that one.
okay. Motion to approve in second. Discussion. Why is it shorter? I don't
Yeah.
know.
Lot shorter.
I think the printer ran out of ink or something, I think, on that one. Okay. All in favor for Gunderson, say aye.
Aye.
Anybody opposed? Motion passes as well. Okay, number 13, consideration and possible action on the program performance management dashboard.
Well, this is what I'm really excited to share with you all. Remember Zach, the Calumet County Health Officer, who is doing his MSN Masters of Science in Nursing rotation from Colorado State University. He was an online student. but also the health officer. This was his project. So I wish he was here.
Okay.
I know he's here in spirit. But he worked alongside Sarah, myself, and the staff to create a program performance management, not only policy, but dashboard. And so this is a way that health departments can track, their different programs and also know when to drop some programs off maybe, or if you want to put resources and make them more robust. So we're setting a baseline with this dashboard, but it's really something that health departments who are going for accreditation are moving towards. It's called program performance management. And so really excited about having this on the agenda every quarter to give you all progress, and likely in the years that will pass by, I think the metrics might change, programs will change, but at least we have a mechanism to understand maybe what is not so popular. Or maybe because the community has embraced that whatever program and we can move on to something else, or something that is like, ooh, that's really, we need to get more people involved with XYZ and we need to bolster those numbers to put more efforts because the community isn't embracing this in our infrastructure of, programs within the community. So we broke this out. Again, this is a first stab. So we broke this out into an administrative section, really talking about annual trainings and professional development type stuff. And then our different programs. So emergency preparedness and response. We have communicable disease control. And we also, on the back side, it's an Excel spreadsheet. So on the back page of that, we have chronic disease and injury prevention, we have environmental public health, we have maternal, child, and family health, and outreach and access, and linking to clinical care. So those are the different things we want, like big picture things we want to track. Now, again, the metrics underneath it will change. We just took a stab at what we currently have data on that falls in those sections. But really what we're looking at is trying to create baselines for this first year and seeing how this goes forward. Also, I want to highlight, we did put our fee revenue collected by program in there, so we can kind of see, where our program revenue goals are. Of course, we can track our expenses in our budgets, but we really want to see how the program revenue is coming in by quarter to see if we're on track or if we're really not on track and something went awry. So we did include the fee revenue collected by program, as well as the organizational goals and objectives. So we have a workforce development goal, and then we also have a strategic plan. I think some of you took part in creating. So really wanting to, track the progress of that and making sure it's looked at, reviewed, and revised. So it's just really, it's accountability, really. And so again, it is, doing this is going to allow us to be more in line with accredited health departments. And so what I've talked about, and Sarah and I have had discussions, we're not sure if we can jump all in and spend the resources and staff time to become accredited, but at least we can be accreditation ready. And so we can prepare ourselves and do the things that accredited health departments do. So,
Can I ask you a question about one of the line items
yes,
here?
of course.
Under your food and beverage licenses,
Yes.
does that include food trucks?
Yes.
Why is DePere's rate for food trucks so much higher than Brown County?
We try to keep it in line. Why is it so much higher? I would have to go back and check with Trista. We try to keep it pretty in line with other adjacent jurisdictions, but I'll check on that with Trista.
I'm thinking in terms of the food truck from ADRC that goes out, and they can't come to DePere because it costs too much to come here for the license.
Oh,
And I was thinking, oh, geez, that's a nonprofit organization, so I don't know
'Cause
if
we
you
would-
differentiate between that with your,
yeah, that's interesting
license
because
would-
we wouldn't have to relicense them in De Pere because if they hold a license, we may inspect them and have an inspection fee. But that's
so if they
pretty
went to a,
minimal.
if they went to a site, they wouldn't necessarily need to pay it.
No,
And it just, oh, well,
no.
I'll have to-
And
So
some-
do tell them that.
I will. We've got a
Some
meeting later
agencies
this
very,
week.
Yeah.
and some agencies will say, we're going to license you as well. I mean, it's,
Some agencies,
some agencies do
Right.
that, and some agencies say, well, you're licensed already. You don't have to be licensed except for the inspection fee.
Yeah.
Because I know they're going to a lot of places in Brown County, but just haven't come to DePere.
So
And
have
they're
them call.
licensed
I will.
in County. Yeah, because as long as they're licensed in Wisconsin,
Okay.
then we accept
it's
that
current.
license.
Yes. Oh, yeah, yeah. So, yeah,
And
they're good with
They
that.
may face a $40-some inspection fee if Trista decides to inspect them, but
That would be a reasonable fee.
Yeah.
So,
Yeah, but I think Trista and Debbie before me tried to keep our fees pretty
Okay.
consistent with adjacent jurisdictions because
Maybe-
we wouldn't want that to happen, right? Where
maybe it
people-
was old information or wrong
Yeah.
information, but I'll,
Yeah.
and so they should call you then about that?
Trista.
Call Trista.
Yes.
Okay.
I mean, they can call me too, but she'll
Okay.
be the best.
All right. Thank you.
Yeah.
Now, Krista, I want to ask, you have changed this to reflect a peer,
Yes.
haven't you? Then,
That's
okay.
correct. Yep. A lot of the same performance measures were borrowed from the jurisdiction that was using this because one health department looks a lot like another health department. But there are some that we changed to DePere related
Well, being a
programs.
level 2 program agency versus a level 3, I imagine level 3 probably has multiple
A lot
pages, a
more,
lot more than
yeah.
this would be.
Yeah.
Okay.
Right. Right, but we're super excited to start using this and even tracking, our tracking mechanisms that we have now in our Outlook calendars to track our outreach, education, just so we can put it in this spreadsheet.
Do you have any standout things that jumped in? It's like, oh, I want to jump right on that.
Yeah, one that I am really monitoring is the environmental health, and it's on page 2, so on the back side. That first page
Okay.
is kind of blurry, so we'll fix that in the next rendering for you all. But on the back side, where we talk about, now remember, the DATCAP, DSPS, facilities inspected, that starts July 1st. So that Q1 is just started July 1st. So that's why there's a star in those.
Okay.
But I'm very interested to understand the staff capacity because we have so many new establishments and establishments changing owners that I really want to see where the number of inspection falls with the 0.8 FTE that we have assigned. So once we start getting like at 100% or 110% of the standard, that's when I likely will be coming to administration and to you all saying, okay, we're gonna need to shift some of her workload off, maybe weights and measures, and then allow her to have more FTE for inspections with DATCAP restaurants, because again, we're seeing so much growth. So that's one I'm really excited to monitor. Everything else, of course, our community engagement and outreach events, it's always fun to see. Again, that was a shot in the dark at 100. It'll be interesting to see where it lands. I just feel like we are so engaged with the community and doing a lot of great work. So that one will be another fun one.
Yeah, very good. I love seeing this where it's quantifiable data.
Yeah.
How is that Steps to Safety program going?
Yeah, there are low numbers with
Yeah,
that
I wish
one.
more would do that.
I know. And I do think, I like it because it's a really neat collaboration with the fire department. And it really gets us out in the community and into the homes. I think there's hesitation, with allowing people to come into your private residence. And even though it's education, it's very personal. right? And you're allowing them into your space. And so,
And it may be that they've sought ADRC's help with that, because I know that we do get referrals for people that do something similar. It's not the steps to safety, but
Right.
there are people that will come in and inspect
yeah.
safety in homes.
Yeah. So that is one I'd love to see an increase, you know, but I think the numbers will tell us that,
Yeah.
right?
Thank you.
Very nice.
Yeah.
Well, I like what you've done to it. I just wish the font was a little bit
I
bigger.
know. I know Kelly and I were trying to figure out. No.
I'm like, well,
It's
if
a
they're on
kicker
their
to look at, you
computer,
know.
they can enlarge it.
I did enlarge it on here. It's like,
Poor Dennis.
Yeah, are you able to let him know that he did a great job on it?
I will. I'll pass that
Yeah.
sentiment.
I'm sure it was a lot of work.
Yes. He did a great job. And the fun thing, and we said this from the beginning, because he is the health officer at Calumet County Health Department, he's also going to be implementing this at
Oh,
his
cool.
health department. And so
he had a vested interest.
it's a win-win-win.
Yeah, he should.
Are there other agencies that are also incorporating this as well?
Yes.
Within our region?
Yes.
Very cool.
Okay,
Yes.
good.
Yeah, Brown County Health Department was just accredited, and they had this as well.
Okay.
So I know other agencies too, Appleton and others use it. So
Okay, can we have a motion to accept consideration and possible action on the performance management dashboard?
So move.
So moved. Here's a
I'll
second. Any more discussion on this? Hearing none, all in favor to have the Pere City Health Department pursue this, say aye.
Aye.
Any opposed? Motion passes. Okay. Be interesting. Now I could read it a little bit more. Okay.
we'll try to blow it up
Yeah.
next time.
Quarterly report, meeting, training, education, outreach.
Okay, so as you read in the previous memo, if approved, that program performance measurement, I would propose that dashboard replaces these, but I wanted to put them on the agenda just as a duplicative until I knew that performance management had been approved. So you'll see the meetings, trainings, and that should all be.
Okay.
What are you collaborating with the Malva Center for?
Yeah, so the Malva Center, we are doing a lot of social connectedness events in September. So watch our Facebook page and look at our website. So we are doing a documentary, and it's kind of, the title is a little bit frightening. It's called Join or Die, which is like, but it really is about civic engagement and the importance of civic engagement. And it also, there's evidence that it improves your health outcomes, right? And so we're really trying to get the community to attend and watch that documentary. We're covering the cost of the film and the admission fees, and also we want to have civic organizations have booths at the event,
wow, nice.
so that if someone wants to sign up and, you know, be on the beautification committee, or, you know, sign up for Kiwanis, or get involved with Rotary or whatever, that they can do that that night. So if you can help spread the word with that, again, it's on our Facebook, it's on our website, and it is that last Thursday in September. And for those who haven't been, I know you all have probably been to the Malva Center, but a lot of our community members haven't. And so we would love to even see them engage with that beautiful resource that really is affordable for people. So.
I wish I could come. I'm going to be in Virginia for my son's wedding.
Oh, well, a good
Can you
excuse.
change your wedding?
Now, Terry, you have to set your priorities. That's all I have to say.
Stick back and go.
This is more important. I think you have posters too, because Danielle drops them off.
Yeah, yeah.
Very nice.
Yeah. You have them on your bulletin.
Yeah, we did. I think it's very important now that they do get out and socialize and do other things, and it really does help.
Yeah, me too. Me too. So my proposal would be to, and if ever you have questions on our community engagement events, we can talk about that in the program performance management dashboard. But then hopefully sunset that Excel spreadsheet and move to this Excel spreadsheet.
I think if there's a way to why duplicate something if we don't need it, I guess, so I think that'd be a good idea once the other one gets fleshed out a little bit more, so.
Yeah, I agree.
Number 15, communicable disease report, the quarterly report.
Yeah, so Danielle very graciously put together that communicable disease report. Does anyone have any questions on it?
Have you noticed anything? I mean, it looks like we don't really have anything that stands out as being communicable too much in the Pere at all.
No. And you know that treating that LTBI, that latent TB infection case, that's something we talked about already, but that's really standard anyway in local health departments. So nothing really stands out.
Not the bird flu or?
That's good. Yes, thank you.
Well, but the only thing I can recall is there's monkeypox in Africa now that they had. That was in the news last week, I believe. And
Will you be doing flu vaccines and COVID vaccines in the community this winter and
Yes.
providing those at no charge for
Yep.
the Pere?
At no charge. And then we actually have 10 doses of adult vaccine for those who don't have insurance. So a very small supply, but likely we could get more. But yeah, we'll have private pay. We'll have the small supply of adult doses for those who don't have health insurance. And then, of course, the no-cost vaccine for children, influenza vaccine, and COVID vaccine as well.
Will you be doing clinics or do they need to come to the health department?
We're going to try them at the health department to try to get back into normal operations. And we'll see how it goes. We'll see if that fares well or if we need to go back, doing them in the different parts of the community. But, without the LTE staff, it is, to keep it centralized, we'll see how it goes. But knowing that we could take our mobile unit out at any time.
I was just going to say, what about the mobile unit?
Yeah, we'll definitely consider.
can you drive that now?
I cannot drive that. Chief
We
took
did.
it. Chief Al took it when we were at National Night Out. And I was watching him go around the roundabouts, and I am like, there is no way I could drive that thing.
Well, you have to get out and practice, I guess. That's all there is to it. Just let us know.
Yeah.
So we're off the
I
road
need
now,
orange
okay?
I saw somebody driving it. I never got to meet up with all of you, but I did see it driving around the Pere. But we were like 2 steps behind.
Oh, were you? Yeah. We had Mayor in there for a while and Stanley.
Oh,
Yeah.
Stanley.
Yeah, we had Stanley. So.
Who cares about the mayor?
Stanley, right? Everyone
Just
wanted
kidding.
the pictures of Stanley.
Who's Stanley?
He's the
fire
fire dog.
Oh.
He's the.
Okay, environmental health quarterly report. Awesome. Would you like to come up and talk a little bit about this, what you're doing? Just so we get up here, see you get out of the shadows, come on up if you'd like, and tell us a little bit about TRHs and what you've been doing here with us, with the Pere.
We're waiting.
Well, I guess for TRHs, we've had maybe 24 that I've done personally. Some of those are new, about maybe half. We've had about 8 or so. I haven't done the count. I probably should have prepared that, but I didn't. No, I was going to speak.
I'm putting you on the
You're
spot.
doing
It's
great. You're
okay.
doing great, Austin.
So there's definitely an uptick. When I talk to the people, they're like, oh, we're doing this for the draft, the NFL draft coming in the next year, beginning of next year. So there's a lot of new ones for that and Packer games just in general. So
And what other things you've been doing besides TRHs? Just everything with Trista as well, inspections of restaurants and hotels and so on?
yeah, I'll help her with like restaurant inspections, couple hotel inspections. I've done some public health newsletters in relation to like from Sarah when she goes to the library, or other posters or things that we put up on the TV, like from Canva, variety of things like that.
Oh, also
Pool.
your pool sample.
Oh, I've done pool sampling. Every 2 weeks, the outdoor pools need to be sampled, and then every other month, the indoor pools in the city get sampled. So I had a day where I did, I think, 14 pools.
Okay.
Yep.
Are you also involved in nuisance complaints?
I don't think we've had any, so I don't know
No?
if I've.
We got to work
involved.
on that. That's
So-
Oh,
that's something that
We've
you
done a
gotta
couple
do.
door knockings,
Uh-huh.
following up on complaints with like noise meters and things like that,
Okay.
but
No.
nothing with tons of follow up.
And where are you going to school at?
Concordia in Mequon.
Okay. So you're just residing up here temporarily until you.
Yeah, I live in Appleton.
Oh,
at
okay.
home, so it's a 30-minute drive. Not bad at all.
Okay.
That 41 corridor.
Yes.
And how long will you be here?
My last day is on Thursday.
Oh,
Oh.
wow.
Yep. And then the following week I move back to school. So
very good.
We're
That's
very
not fun.
sad
yes.
to see him go.
Yeah.
But understand.
Are you sure you just don't want to stay here?
That's what I said.
School's overrated.
Well, thank you very much for selecting the Pere or for
Yeah, thank you.
Yes. Thank
for
you
being here in
for
the Pere
having
and
me.
helping with our program here as well. I hope you've learned a lot. It's
Yes,
been a
absolutely.
good internship for that. So thank you very much, Austin.
Thank you.
And best to you. You got one more year left in school then, right?
Two.
2 more years. Okay.
And then probably grad school. So
Okay. Great
And you'll be
then.
back?
Yes.
maybe.
Crystal?
Working with Peter and
Right.
Crystal?
Yep.
I see that there's in that bottom paragraph that you changed from, I guess Trista must have been doing them during COVID because of nursing.
Other.
Nursing was doing lots of other things.
Yeah.
So now it's just gone back to what it was before.
Right. So really,
bite.
yeah, Sarah has been taking a bulk of the animal bite follow up, and then I'll assist when there's overflow. But that's really helped Trista free up her time so she can be out in the field more. So
Do we have a lot of those?
animal bites, yeah.
We do.
Yeah, it seems like this last week it was more than the previous week since I've been here. But tis the season. It's summer and people are out and about. So
I think our first meeting, right, there was an animal situation.
Oh.
Yeah.
Oh, yeah.
before I got here, yeah.
Yeah.
It wasn't
Was that the hour-and-a-half meeting that we had? Just to discuss animal bites, or a special meeting we may have had as well, I don't recall, but
Yeah, it
No
was
more-
nice welcoming.
Yeah.
good way to start and initiate new staff here, I guess, right? New committee members.
That's worse.
I was like, whoa.
Yeah, 2 to 3 a week, I would say.
Yeah.
How many pools do we have total?
Oh, how
Well,
many?
there's
I
2
should know
outdoor
that.
pools, and then I think there's half a dozen indoor locations that have
Like
1 or
hotels.
2. Yeah.
Apartments.
Yep. Apartments. Hotels.
yeah.
Oh, you do those? Wow.
Yep.
But when you sample, do you sample each basin at those outdoor pools or just one?
Well, so VFW has 3 separate ones: the slides, the main pool, and the wade pool. And then Legion has the wading pool and the swim pool. So, at each location, there can be anywhere from 1 to 3, 4 different
Samples.
samples.
Yeah.
Yep. And then I take that to Brown County.
What kind of disinfectant do they tend to use? Is it chlorine, bromine, or do they use anybody using salt as well?
It's all chlorine except
chlorine.
for one was bromine. It was a hot tub at an apartment, but they were in the process of switching it over to chlorine.
Okay.
So I think by now it's chlorine.
Okay.
So,
But no salt.
no
no
salt.
salt.
Yeah.
Nope.
Well, keep up the work and best to you after this week, okay?
Thank you.
Thank you very much, Austin.
Do you also have to do the Y?
No, I don't
No?
think that's in
That's
Dubuque.
in Alloway.
It's an hour.
Yeah.
Oh, Brownfield.
That's
Yeah.
in Alloway, so that would not be our responsibility.
Well, there's, that's right, Pure doesn't have a pool. They do have a hot tub though, which never works.
Oh, which never works.
Down at Kenya.
At the Y?
Yeah, they have a sauna and a hot tub that is always out of order.
Oh.
I'll talk to you about hot
I
tubs
didn't
after
say
the meeting. Okay, I just lost my agenda here. What did I do? Here we go. Consideration number 17 and possible action to approve amending section 106-4 of the De Pere Municipal Code, tourist room and home licensing violations.
Yes, so this is an ordinance change proposal. I've been working with Pam in finance and Eric in the attorney's office, and we talking about mirroring other jurisdictions, adjacent jurisdictions. In April of this year, Brown County Health Department raised their penalty provisions for those who aren't getting the proper licensing and inspections for tourist rooming houses, up to $2,500. And so, so this proposed ordinance revision would be in line with our partnering, jurisdictions, our adjacent agencies, because what we don't want, right? People deciding to do this for the draft, which is fine, but then not going through the proper channels, and God forbid if something horrible would happen if they didn't have a working smoke detector or whatever, and something would happen tragically. So we want to make sure that those who are renting out their properties are following the state guidelines and have all the health and safety aspects and components that a registered tourist rooming house would have, like screens on their windows on the second floor, things like that.
Yeah, I was just gonna speak to that because we just had a operator who they were operating without a license, and they got an email from Airbnb that license renewals were coming up. So he didn't know that he wasn't licensed. So he came in saying, "Oh, I'm here to renew my license," but we had to begin the process to license him, and all of their smoke detectors were expired by 20 years, and their carbon monoxide was expired by 10 years.
Wow.
So I just released their license after they gave proof that they bought new smoke alarms. So stuff like that definitely does happen.
And you have to go back out and check after?
For smoke alarms, I usually, it's acceptable if they take pictures of them, like it being in the house, and then just to save us time to not have to go back. But if it's something more major, like with cleanliness or something like that, definitely we'll go back. But
Yeah. So again, this ordinance revision would be in line with what Brown County has already done in April. And so bringing that forward for your consideration and to pass along to
So
city.
what specifically did we change? The fee, the actual penalty?
Yeah, right,
To $2,500.
right. Yep. So we increased that threshold to $2,500.
What was it before?
200, 250,
That's a
something
big
very,
jump.
yeah, very low.
How do you plan to promote the concept of licensing TRHs so people are going to be aware that if they are going to be renting out their homes, that they need a
Yeah.
TRH license?
That's a really good question. Luckily, with the NFL draft, there's been a lot of media about, if you want to rent out your home, and they talk a lot about Green Bay and Ashwaubenon, but in their promotional materials, they also say, and in the city of De Pere, you need to contact the city of De Pere.
Yeah.
And so it's not only the health department, but it's also our planning department. And so they're in all of the outreach materials that, the draft, and I forget, it's not definitely De Pere, it's called the Green Bay, what's the Green Bay one? Anyway, it's their promotion that they're putting out a lot of information. In fact, they had like a good long clip on the news and getting a lot of newspaper. I think there was just an article in the Green Bay Press Gazette about it. So, so definitely we are on the shirt tails of that publicity, and then referencing, we are embedded on that main website that links to the city of De Pere for those interested in renting out in the city of De Pere. So
Now, is that renting out a house, or how about if they just rent out a room?
if they
In their
rent out
house.
a room, yes.
They rent out a room, that's also classified as a
Yes,
TRH?
I do believe so, yes.
a lot of people will do sometimes just a basement,
Yeah.
Mm-hmm.
and that counts as well.
Okay, so
Even
whether it's a room or a
campers.
house or whatever, camper.
Camper, that's another one.
Consider it, Dennis.
You could, when you're,
Rent out your house.
No, thank you. Be mind like I'd be the one that's stuck with a $2,500 fine for that one, I guess. Okay.
I think Green Bay just had a meeting for their landlords, and it was on the news.
yeah, I think so too. Yeah, and Brown County Health Department was at that. Trista did ask if Brown County was going to be there, and they had all of that material as well. So linking people to peers. So.
I think it's going to be looked at as an opportunity for many people to make some quick cash, like EAA down in Oshkosh. And so hopefully they're going to be honest and can notify the health department that they are going to have a TRH and be renting out a room or their house or a camper or their backyard or whatever, I guess. And then you need a campground license, wouldn't you?
Yes.
Okay. So let's hope that the message keeps coming out all the time then, I guess, on that, so we don't have to get a lot of irritated people.
And we do like to take an education approach, like for the example that Austin described, where the person didn't even know. So then, just giving them the opportunity to get licensed. But if we have,
You do notify them beforehand, and if they do not comply, that's when the penalty comes across, okay.
Yep.
Intersection of 9.
So that would have to move forward if you all approve that.
Yes, let's have
Council
a
of Finance.
motion for consideration and possible action for the tourist rooming house licensing
So tomorrow?
I so move.
changes. So moved.
Second.
Here a second?
Second.
Any discussion?
Tuesday.
Hearing none, all in favor of changing this, say aye.
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 Aye. Opposed? Motion passes.
Thank you.
And Austin, best to you as well
Thank you.
next week and in school and the next 2 years in your master's program
hold
as
that.
well, okay?
So, what are you talking next Monday then?
Future agenda items,
7.
any discussion on that right at this time? Okay, hearing none, motion to adjourn,
So moved.
so moved. Second,
Second.
Second.
any discussion? All in favor, say aye.
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 Opposed? Meeting is adjourned.
Thank you.
Thank you.